Good morning everyone. My name is Dolce Sharma. I'm working as a clinical instructor in RPI IIT College. Today we'll discuss about the topic urine retention. Definition: inability to pass urine voluntarily. There are multiple causes for urine retention. Acute retention. Acute urinary retention is the sudden inability to pass urine. It is usually painful. Chronic retention, no painful bladder that remains palpable after voiding, inability to completely empty the bladder despite maintaining an ability to urinate, which results in elevated post-voidal residual urine volumes. Causes of urine retention: obstructive, infectious and inflammatory, drug-induced, neurological, other causes. Obstructive cause common to men being prostatic hyperplasia, meatal stenosis, paraphimosis, penile constructing bands, phimosis, prostate cancer. Obstructive causes of urine retention commonly to female: organ prolapse, cystocele, rectocele, uterine prolapse, pelvic mass, gynecology, malignancy, uterine fibroid, ovarian cyst, retrograde gravid uterus. Obstructive causes common to both the genders: aneurysm, dilation, urethral strictures, bladder calculi, foreign bodies, stones, edema, bladder neoplasm, fecal impaction, gastrointestinal or retroperitoneal, malignancy, mass. Infectious and inflammatory: men, balanitis, prostatic abscess, prostatitis. Women, acute vulvovaginitis, vaginal lichen planus, vaginal lichen sclerosis, vaginal pemphigus. Infectious and inflammatory, both genders: cystitis, echinococciosis, Guillain-Barré syndrome, herpes simplex virus, Lyme disease, periurethral abscess, transverse myelitis, tubercular cystitis, urethritis, varicose-zoster virus. Drug-induced, both acute and chronic retention. 10% AUR drugs related: anticholinergic, opioid and anesthetics, alpha adrenoceptors, benzodiazepines, non-steroidal anti-inflammatory drugs, Dratusser, calcium channel blockers, antihistamines. Neurological, more often causing chronic retention but may cause AUR. Autonomic or peripheral nerve, example autonomic neuropathic, diabetes mellitus, Guillain-Barré syndrome, pernicious anemia, poliomyelitis, radical pelvic surgery, spinal and cord trauma, TAPS dorsalis. Brain, example cardiovascular disease, multiple sclerosis, neoplasm, normal pressure hydrocephalus, Parkinson's disease, spinal cord, intervertebral disc disease, meningomyelocele, MS spina bifida occulta, spinal cord hematoma or abscess, spinal cord trauma, spinal stenosis, spinovascular disease, transverse myelitis, tumors, chioda equina. Other cause: in men, penile trauma, fracture or laceration; in women, postpartum complications, increased risk with instrumental delivery, prolonged labor and cesarean section; urethral sphincter dysfunction, Fowler's syndrome; in both pelvic trauma, iatrogenic, psychogenic. Features of acute retention: pain in abdomen, history of inability to pass urine, distended bladder on palpation. BPH, one of the common cause of urine retention. Lower urinary tract voiding symptoms including frequency, urgency, nocturia, straining to void, weak urinary system, hesitancy, sensation, incomplete bladder, emptying and starting of urinary streams. BPH usually comes a chronic retention, but usually these people come to the attention when they get an acute on chronic retention. Otherwise, these people most of the time are unaware about the LUTs which are due to BPH. History taking: pay attention about course of development including onset and progression. Have you any fever, any previous episodes, any history of BPH, LUTs, past medical history, neurological disease, other medical conditions. Take the drug history. Ask about alcohol, constipation, long travel.